Hi, my name is Fernanda Garcia Perez. I'm going to talk about Alirocumab and cardiovascular outcomes after acute coronary syndrome. Definition. Alirocumab injection is used together with a proper diet and other medicines to treat adults with heterozygous familial hypercholesterolemia who need additional lowering of their bad cholesterol.
If you have acute coronary syndrome, you have one or more conditions caused by a blockage of blood flow to your heart muscle. This is a medical emergency because you may be having a heart attack, a condition in which your heart muscle begins to die. Your heart is a muscular organ that pumps blood containing the oxygen and nutrients your body needs. The main pumping chamber of your heart is the left ventricle. When your left ventricle contracts, it sends oxygen-rich blood to your body through a large artery called the aorta. Connected to your aorta are small arteries called coronary arteries. Blood flows from your aorta through the coronary arteries to supply your heart muscle with oxygen and nutrients. If you have acute coronary syndrome, blood flow through your coronary arteries is severely reduced or completely blocked. One possible cause of reduced blood flow is atherosclerosis. In this condition, a buildup of a fatty substance called plaque can narrow your coronary arteries. If this plaque ruptures, a blood clot can form and block the artery. A blood clot is the most common cause of coronary artery blockage. Other less common causes of reduced blood flow include coronary artery spasm or dissection. In a coronary artery spasm, triggers such as drugs, smoking, cold weather, and extreme stress or emotions can cause a temporary and sudden tightening of a coronary artery. During a coronary artery dissection, the inside wall of one of your coronary arteries separates, which can block blood flow. Regardless of the cause, a blockage in either coronary artery prevents the oxygen and nutrients in your blood from reaching the part of your heart supplied by the artery. As a result, heart muscle in that area starts to die. Death of part of your heart muscle is called a heart attack. It's also known as a myocardial infarction, or MI. A blocked coronary artery may also cause you to feel sudden pain, discomfort, tightening, or a burning sensation in your chest, called angina. This pain may extend to your upper abdomen, shoulders, arms, neck, and lower jaw. If you have angina when you're at rest, or frequent angina that prevents even moderate physical activity, you have unstable angina, which is the main symptom of acute coronary syndrome.
Applications in medicine. Alirocumab reduced LDL cholesterol levels by 62 percentage points at 24 weeks, with a constant reduction over a period of 78 weeks of treatment. Pathological history, such as heterozygous familial hypercholesterolemia, dyslipidemias, established coronary disease, cardiovascular risk factors, and LDL cholesterol greater 70 milligrams per deciliters.
Hey patients with acute coronary syndrome are at risk for recurrent ischemic cardiac events. Some of this risk is attributed to elevated levels of low-density lipoprotein, or LDL, cholesterol, and other atherogenic lipoproteins. Proprotein convertase subtilisin kexin type 9, or PCSK9, promotes the degradation of LDL receptors, which results in decreased clearance of LDL from the circulation. A monoclonal antibody to PCSK9, Alirocumab, has been shown to reduce LDL cholesterol when administered alone or with statins. This randomized controlled trial involved 18,924 patients who had been hospitalized for myocardial infarction or unstable angina in the previous 1 to 12 months, and who had one of the following despite high-intensity or maximum tolerated statin treatment: an LDL cholesterol level of at least 70 milligrams per deciliter, a non-high-density lipoprotein cholesterol level of at least 100 milligrams per deciliter, or an apolipoprotein B level of at least 80 milligrams per deciliter. Patients were randomized to receive either 75 milligrams of alirocumab or placebo subcutaneously once every 2 weeks, and were followed for a median of 2.8 years. Alirocumab was titrated in a masked fashion to achieve a target LDL cholesterol level between 25 and 50 milligrams per deciliter. The primary endpoint, a composite of death due to coronary heart disease, non-fatal myocardial infarction, ischemic stroke, or unstable angina requiring hospitalization, was significantly less frequent in the alirocumab group than in the placebo group. Adverse events were similar between the two groups, except for local injection site reactions, which were more frequent with alirocumab. The authors conclude that alirocumab reduced major adverse cardiovascular events in patients with a recent myocardial infarction or unstable angina, as compared with placebo. Full trial results are available at nejm.org.
Pros and cons. It is also used to reduce the risk of heart attack, stroke, and unstable angina. This medicine is PCSK9 inhibitor. Adverse events. Laboratory anomalies, anomalies of vital signs, electrocardiographic anomalies, cardiovascular events.
In individuals with insulin-treated type 1 or type 2 diabetes mellitus, hypercholesterolemia is a major risk factor for macrovascular complications. Statins lower low-density lipoprotein cholesterol, or LDL-C, and reduce cardiovascular events in these groups. Yet many individuals still don't reach target LDL-C levels with this approach, leaving a significant residual risk of cardiovascular events. Alirocumab, a monoclonal antibody that functions as a PCSK9 inhibitor, is approved for reducing elevated LDL-C levels. Theoretical considerations have been raised regarding the use of PCSK9 inhibitors in individuals with diabetes. Particularly, questions over the safety of co-administration of a biological agent, insulin, with a monoclonal antibody, alirocumab, the effects on glycemic measures, and the change in anti-diabetic medication use. This uncertainty prompted researchers to investigate the efficacy and safety of alirocumab in insulin-treated patients with diabetes, showing elevated LDL-C despite maximally tolerated statin therapy. The Phase 3b Odyssey DM insulin study was the first trial with a PCSK9 inhibitor that specifically randomized individuals with insulin-treated diabetes at high cardiovascular risk who had elevated LDL-C despite receiving maximally tolerated statin therapy, and included 517 participants with type 2 or type 1 diabetes randomized 2-to-1 to receive either alirocumab or placebo. The primary efficacy endpoint was the % change in calculated LDL-C from baseline to week 24. Primary safety endpoints included treatment-emergent adverse events, laboratory data, product technical complaints, and vital signs. The results showed that alirocumab was superior to placebo in reducing LDL cholesterol in both groups, lowering baseline levels versus placebo by 49% and 47.8% in participants with type 2 and type 1 diabetes, respectively. The researchers also observed significant reductions in non-high-density lipoprotein cholesterol, apolipoprotein B, and lipoprotein A. Alirocumab was well tolerated and did not affect glycemic measures or the dosing of glucose-lowering treatments. Also, the concomitant administration of alirocumab with insulin did not raise any safety concerns. Overall, the study demonstrates the feasibility of concomitant therapy using insulin and alirocumab. Using PCSK9 inhibitors such as alirocumab to reduce LDL-C in individuals with type 1 or type 2 diabetes may offer a much-needed way to reduce cardiovascular risk.
Usual plate in Ecuador. A study conducted at the Pontifical Catholic University of Ecuador shows that 700 patients treated with placebo and 1,400 with alirocumab showed a detection of adverse events with a rate of 0.2% or more in the group receiving alirocumab with 95% confidence. In conclusion, among patients who had a previous acute coronary syndrome and who were receiving high-intensity stent therapy, the risk of recurrent ischemic cardiovascular events was lower among those who received alirocumab than among those who received placebo.
In individuals with insulin-treated type 1 or type 2 diabetes mellitus, hypercholesterolemia is a major risk factor for macrovascular complications. Statins lower low-density lipoprotein cholesterol, or LDL-C, and reduce cardiovascular events in these groups. Yet many individuals still don't reach target LDL-C levels with this approach, leaving a significant residual risk of cardiovascular events. Alirocumab, a monoclonal antibody that functions as a PCSK9 inhibitor, is approved for reducing elevated LDL-C levels. Theoretical considerations have been raised regarding the use of PCSK9 inhibitors in individuals with diabetes. Particularly, questions over the safety of co-administration of a biological agent, insulin, with a monoclonal antibody, alirocumab, the effects on glycemic measures, and the change in anti-diabetic medication use. This uncertainty prompted researchers to investigate the efficacy and safety of alirocumab in insulin-treated patients with diabetes, showing elevated LDL-C despite maximally tolerated statin therapy. The Phase 3b Odyssey DM insulin study was the first trial with a PCSK9 inhibitor that specifically randomized individuals with insulin-treated diabetes at high cardiovascular risk who had elevated LDL-C despite receiving maximally tolerated statin therapy, and included 517 participants with type 2 or type 1 diabetes randomized 2-to-1 to receive either alirocumab or placebo. The FDA has now approved an entirely new class of cholesterol-lowering drugs known as PCSK9 inhibitors. These are very powerful drugs that can lower the bad cholesterol by 50 to 70%. They're given either every 2 weeks or once a month by injection by the patient, very simple injection. They are very well tolerated, have few if any side effects, and they're particularly attractive because they appear to work well and not produce muscle side effects in people that have muscle pain when taking the conventional drugs, the statins. These drugs were approved and they are intended to be used for people that already have coronary heart disease, that have had a heart attack or bypass or a coronary stent. They're not for people that have high cholesterol that have never had a coronary event. This population that we treat that already has heart disease is referred to as secondary prevention because it's secondary, it's after the first event. These drugs are not approved and they're not indicated for primary prevention to prevent a first event. The FDA.
Thank you.